Hi, I'm Dawn Van Vliet. I'm the swing bed coordinator, and this is my job at Scheurer Health. A swing bed program is a Medicare-based program. It is for patients that no longer qualify to be hospitalized, but they are not safe enough to return home. So the goal is to get them back to their prior level of functioning so that they can safely return home. The difference is they don't need that highest quality of care in the inpatient, but they still need some form of skilled nursing care, whether that be rehab services, education for new diabetics, post-surgical care, just additional skilled care to get them to that next step before going home. There are certain insurance restrictions that come with that. However, Medicare HMOs, Medicare PPOs, some commercial insurances qualify. So that has to be checked on the financial side to make sure patients qualify through their insurance. I deal with the insurance aspect of things as well. So if they need authorization from their insurance, that's obtained prior to them being admitted to the program. A typical day for my utilization management role, I come in daily. I screen patients that are currently admitted to make sure they have criteria to stay. Any new admission from the emergency room, I'm contacted to screen those patients as well to see if they meet for inpatient or observation. Work with the physicians, with the patients that are on the floor, whether they're nearing discharge, they're ready for discharge, work closely with the social worker to find out the best plan for the patients, whether they could potentially stay for swing bed if therapy, has been done and they qualify, or if they need, home care and they're just discharging. So just kind of making sure that the patients are getting the care they need. It's mentally, physically, emotionally draining to be sick. So I love to see when they work their way through our program, they gain confidence, and they're just ready and excited to get back home. Teamwork is very important for swing bed. Like I said, lots of coordination of care with all of the team members, from therapy to even our materials management. If patients need specialty mattresses or we need to order tube feeding supplies or whatever, down to dietary restrictions. So I just make sure everybody's providing the best care for that patient's individual situation. Everybody has to kind of be on the same page. And those swing bed care meetings that we hold at the patient's bedside is a great tool. We touch base on the patients every day, but to have everybody in the room, everybody communicating what's going on in front of the patient, with the patient involved, with families involved, that kind of just coordinates all the care so that the patient's getting the best care they possibly can. Families obviously appreciate having their loved ones close by. It's great to have them involved in the patient's care. It helps healing for the patients, obviously being around their family. It helps their emotional, well-being as well, having family close. As a whole, patients recover quicker and faster with having their loved ones around and nearby and able to visit. I hear from patients constantly when they return to us. They're so happy to be back. It's just something about being local in their hometown. They feel safe. They feel comfortable here. They just praise wherever they came from. I've been hospitalized. I've been to so many facilities, and they just can't wait to get back to us. Our goal is their goal. We want what they want. We want what's best for them as well, though, like safety. We obviously want them to get back to their prior level of function, or better if we can achieve that. Personally, Scheurer Health feels like family to me. I've been here for a lot of years. The management is very supportive here. We have excellent staff here. You can go to people with concerns. They get addressed. I've just always felt comfortable here. You're appreciated. The line of work, obviously, patients appreciate you. You just show up to do something that you love day in and day out. Doesn't feel like work. I feel Scheurer provides the highest quality of care. I wouldn't want my family to go anywhere else. Me personally, I've been transferred, and I told my doctor, never again. So I know we provide great care, and I'm just proud to be part of that. I am Dawn Van Vliet, swing bed coordinator, and I am Scheurer.